So how are we giving protection to preborn sea turtles left and buried in the beach on Pensacola, yet we're not giving that same kind of protection for the babies in the womb?
What I so appreciate about where you're coming from, both as a believer, first of all, but then as a trained physician, an OBGYN, how many pregnant women have you served over your career?
Since 1999, I've delivered over 5,000 babies now, mostly singleton, but twins, triplets, quadruplets.
Wow.
So the mom is my patient, but the baby's my patient as well. And especially with high-risk obstetrics, we are now not diagnosing, not just treating, but we are curing the babies in the womb. So if I have quadruplets, I have 5 patients that walk into my office every time they come for a visit.
Now, the skeptic's going to say, do you get to bill it 5 times then?
Do not.
Okay. I just want to make sure. But in light of that, one of the things that is so amazing, and I would like a little more filling in the picture of those in utero surgeries that are going on now. I mean, for things like spina bifida and other things that ail a child in the womb, you are able, because you're trained, to go in and do those surgeries to correct some of those issues that they're facing, right?
We spend 12 years in training on how to treat moms and babies as patients. And we have federal law regarding patients' rights. We have state laws regarding patients' Bill of Rights. So if they are a patient, then they deserve protection. And we are now providing blood transfusions to babies in the womb as early as 18 weeks gestation. We're doing open heart surgery where the babies actually have their own anesthesiologist, where a pediatric anesthesiologist will start an IV in the baby's hand that has been brought out of the womb, and the babies are receiving fentanyl for pain and a paralytic called Norcuron, so they're not moving around, and they are removing tumors from the heart. We're doing brain surgery. Spina bifida corrective surgery is now in its 3rd generation. We all remember 25 years ago in 1999, the picture of the hand that came out from the womb.
Yeah.
That was Samuel Armas. Well, Samuel Armas is now out of college. He has a girlfriend. He plays basketball. Samuel was a patient in the womb, and now he has an improved quality of life for the rest of his life. But then we started to do these same surgeries fetoscopically, where we place a scope inside the womb, and without making an incision in the womb, we can repair the spina bifida. UC Davis in California has a study called the CURE trial, C-U-R-E, where they are taking stem cells that are harvested from placentas after a baby has been delivered. They then apply these stem cells surgically to the defect in the baby's spine, and the stem cell is called a totipotential cell. These are cells that can become anything. They're like a 5-year-old. They just need some guidance and direction. So the stem cells are placed right on the defect, and they go, oh, my role, my job, I'm supposed to become normal spinal cord. And they develop into normal spinal cord. And babies that were not moving their feet, not moving their legs in the womb, before they're even delivered, begin to move their feet, move their legs. So we not are treating the babies in the womb, we are curing the babies in the womb.
Bill, it's so profound to hear what you're saying, that this is a human being. Why, for those that oppose life, the pro-abortion doctors, for example, they've been through the same training you have been through. Why is there such a discrepancy about what life is?
It's a matter of whether it's not life. We recognize that at the moment of conception, that one egg is genetically unique from mom, dad, and the other 8 billion people on the planet. This, we use science and we use legislation, but this is a spiritual battle. It's like, well, how's this a spiritual battle? You've seen people burn the American flag. Well, why would somebody burn the American flag? Because the American flag is the image which represents the United States. So if somebody hates the United States, they want to destroy the image which represents the United States. In Genesis 1:26, God said, let us make man in our image. So we are created in the image of God at the moment of conception. So at its core foundation, abortion is an attack on the image of God out of a hatred for God. So it's a spiritual battle. It is evil. A lot of the physicians that are performing these surgeries also are advocates for abortion. There's a fellowship, and a fellowship is training after you finish your residency. You can do additional training in GYN oncology, infertility, urogynecology. The fastest growing fellowship in obstetrics now is a fellowship called Complex Family Planning, where after 12 years of learning how to cure and heal moms and their babies, you spend 2 years in additional training on how to do late term abortions and even selective terminations, where you might have a mom who is pregnant with triplets, and in order to increase the likelihood of a term delivery, they can go and they can guide a needle right into the baby's heart and take the life of one or two of the babies. That is Sophie's choice. How can you decide which baby you're going to kill? But that is the fastest growing fellowship now. It's called Complex Family Planning, and it is purely evil.
That's breathtaking, really. This is a good spot to play this. Of course, in the recent presidential debate, the issue of abortion came up. And, I'm not going to speak to the politics or the candidates, but one candidate, along with the moderators of that debate, seem to suggest late-term abortion does not happen, shaking their heads, no, 7th, 8th, 9th month, it just doesn't happen. I want to play a clip for you that I came across on YouTube of a young lady calling a clinic, probing, I think, in order to get the information, but she wanted to know if these clinics did late-term abortion. Let's play this clip and get your reaction.
Yes, we do them a lot. We have been a third trimester abortion clinic since the 70s.
Oh, okay. Okay, so it's normal to have an abortion this late and everything?
Yes.
Okay. Thank you. And I'm just curious, is the baby going to feel any pain or anything?
No, it shouldn't. So what we do is on the first day, we do an injection of a medication called digoxin. Digoxin, what it does is it will gently and slowly stop the fetal heartbeat. And then on the next 2 days, you would have start working on dilating your cervix. And on the 4th day, that will be the procedure day. And basically, they will break your water and induce the contractions of your uterus. And when the sufficient dilation happens, then the fetus is removed and the placenta as well.
Did you catch what that woman on the other end of the line just said about late-term abortions? Yes, we do them all the time. And remember on that debate stage is it never happens. So as a doctor, and what she just said, and I apologize for all the graphic nature of that, but let's get to the truth. What's really going on? How would you critique that exchange that just occurred?
It happens very frequently. That's why there is now a fellowship in training on doing procedures just like this. We have 8 states where abortion is legal at any gestational age for any reason. And then even as far as laboring, normally a labor takes 1 day, 2 days. This is a 5-day process. It is incredibly painful, incredibly emotionally traumatic, but this is why they have a fellowship. It is not rare. It's happening all across the country, including, despite what some people will say, they are allowing babies to die even after they have delivered.
Yeah. That does take my breath away. Like, wow, how inhumane are we? I want to turn to another story that's in the news right now. This young woman who died tragically. Her name was Amber Thurman. That's now been pulled into the political arena as well. One side is saying Georgia's lack of abortion law to provide a medically safe abortion is what killed her. She had to go to North Carolina where she was prescribed the abortion pill. I think before we get to that specific case, just describe the number of abortions, the percentage that are now being done by the abortion pill, the lack of medical oversight in that context, and then specifically to Amber's terrible situation.
Well, since the reversal of Roe versus Wade, the number of abortions has actually gone up. Legislation has changed. The abortion pill has increased from just a few years when we were here last. The number and percentage of abortions performed with the abortion pill has gone from 54% to 63%. The abortion pill is 98% effective in killing a baby in the womb up to 10 weeks gestation. Most new pregnant patients that come into an office are only about 6 to 8 weeks pregnant. At 10 weeks, these babies have fingers, toes, they are moving, they are jumping up and down on the inside, and this is now 63% of all the abortions. With the case of Amber Nicole Thurman, Amber was pregnant with twins. They were 9 weeks along. Georgia has a heartbeat law, which means that if the baby has a heartbeat, you cannot abort that baby in Georgia, same as with Florida. Amber then sought care at an abortion clinic in North Carolina. She ran into a lot of traffic. She arrived late. They couldn't do a surgical abortion, so they gave her the abortion pill. And then he sent her back home to Georgia. The clinic in North Carolina never called to check on her to see how she was doing. 5 days later, Amber was very, very sick. Amber then went to the emergency room. She had a fever, elevated white blood cell count. She had an infection. They contacted the OBGYN on call. He said, well, just start her on some antibiotics and I'll maybe do a D&C in the morning. The standard of care, since there was an infection on the inside of Amber's uterus, would have been to empty the uterus. And here's the key. Neither of the twins had a heartbeat. So how can you blame Georgia's heartbeat law for the death of Amber when neither twin had a heartbeat? But then the medical errors continued. He didn't do a D&C the next morning. It wasn't until 20 hours after she'd been admitted to the hospital that they took her to the operating room. Amber was septic. Amber was so sick they had started her on medications to try to raise her blood pressure. They were just going to do a D&C, but then they realized she was sick. They needed to do a hysterectomy. They opened her up. Not only was the uterus infected, but the bowel was ischemic and dead. Unfortunately, Amber died on the table in Georgia, not because of the heartbeat law. Amber died because of the incompetence and malpractice of an OBGYN who did not follow the standard of care. Our opposition isn't just against heartbeat laws. Our opposition is against heartbeats. They do not value life. They will abort a baby at any gestational age. They will even selectively abort multiples like triplets and quadruplets by injecting individual babies with potassium chloride to kill these babies, but not these babies. And that is why this is a spiritual battle.
Bill, before we leave the political environment, I want to also clear the deck on another falsehood that was out there, that there are no babies dying after they are born. That's just absolutely not true.
It's a lie, and even when it comes to physicians and politicians, if they can't win on the truth and the reality, they will use deception and they will use lies. I mean, Satan is the author of lies and deception. But we know that even in Minnesota, we have testimony and evidence of at least 8 babies that were delivered and allowed to die. That is violation of human rights.
Let me make this point. I did not realize this. I was reading the prep for our discussion today, and our producer, Scott Welch, lifted this up. The U.S. Endangered Species Act of 1973, ironically, the same year that Roe v. Wade was passed, was put in place to protect the turtle eggs on the beaches of Florida, your home state, and to do other things. I was shocked that there was a pro-life group, a couple of them, that filed suit, went all the way to the Supreme Court to include the preborn baby in the Endangered Species Act, and the Supreme Court denied it.
Correct.
So what we're doing basically, and elaborate on this from a physician's standpoint, we're saying turtle eggs, these other endangered species are far more important than the preborn human baby.
We protect turtle eggs in Florida. In fact, during the turtle hatching season, you will see signs, triple layers of signs around all the turtle nest over on Pensacola Beach. All with these signs that say, do not disturb sea turtle nest. Then it tells you what the penalty is for disturbing sea turtles.
It's big.
You can have a $100,000 fine and spend 1 year in jail. Meanwhile, at that same time over on Pensacola, it was legal to perform an abortion up to 24 weeks gestation, even though we had babies surviving in our NICU at 23 weeks gestation. So how are we giving protection to preborn sea turtles left and buried in the beach on Pensacola, yet we're not giving that same kind of protection for the babies in the womb?
Yeah, that's, again, it's shocking. The abortion pill reversal, you work with that, again, as a trained physician. This political battle, you have district attorneys now attacking these pregnancy resource centers that Robin and her team work with every day here at Focus on the Family, claiming they're bad medicine, they're harmful to women, etc. But the reversal pill works, and there's been something like 4,000 or 5,000 babies that have been saved through that practice. Again, for truth-telling purposes, what's the truth about the reversal pill, and how is it used, and how does it save lives?
First, let's talk about the abortion pill. How does it work? It blocks a very important hormone called progesterone. Big word. Progesterone is the progestational steroid hormone. This is the natural hormone that is released by a woman's body to keep a pregnancy going. We have the abortion pill. How does it work? It works by blocking that hormone, progesterone. And within 72 hours, it will kill that baby in the womb. The mom takes the abortion pill, that can kill the baby. Then the next day she takes a medication which causes contractions, a medication called Cytotec. We use Cytotec in normal obstetrics all the time. If I'm inducing a patient who is 40 weeks pregnant with an 8-pound baby, I give her 25 micrograms of Cytotec. The protocol with the abortion pill is 800 micrograms of Cytotec. So when women complain of bleeding, cramping, and pain, it is intense. Well, we all make mistakes. I have said things that I regret. I have done things that I regret. We have a lot of patients. 640,000 women each year have taken the abortion pill, and a lot of them have regrets. We have a hotline, abortionpillreversal.com, a ministry affiliated with Heartbeat International in Columbus, Ohio. So when a woman has regrets and says, "What did I do?" she can call that hotline. The nurses will connect them with a physician geographically located close to them. How can we reverse the effect of the abortion pill? Well, it's just like with fentanyl. We have over 110,000 people that died of drug overdoses last year. The most prolific were going to be with narcotics, with fentanyl being number one. Everybody who makes a bad decision does not die because we have Narcan. You can order Narcan on Amazon.com and it'll be at your house in 2 days. Well, we have another antidote, and that is the antidote for the abortion pill. It blocks progesterone. How do we reverse that effect? We just give the moms progesterone, bioidentical to what her body is already making, progesterone that we use with prevention of preterm labor to save moms and to save babies in the womb. We have over 500 doctors that can reverse the effect of the abortion pill, and we have documented that over 5,000 times. I've attempted that 19 times, been successful 15 out of those 19 times. That's the story of redemption. We are buying back the lives of these babies, the same as when it comes to being redeemed by the blood of Jesus Christ, where 100% of us were heading toward eternal separation from God. We are bought back. We are redeemed through the blood of Christ out of love. These babies have a 98% chance of heading to death, and yet we can buy back those lives with $100 worth of progesterone.
So let's be very specific here. This DA in New York promised to go after these pregnancy resource centers in New York. A higher court has put an injunction on that. Her claim was the reversal pill is untested, unproven, and harmful to women. I think that's generally what the claim was. Specifically, where is she wrong?
She's wrong because we have the evidence. Now, are we going to conduct a randomized trial where we give moms the abortion pill and
Can't
some of
do
them
it.
get not going to do it?
Right.
Absolutely not going to do it. But we have 5,000 documented cases where we have the mom's first name, last name, date of birth, what the first day of their last menstrual period, when they took the abortion pill, when they took the reversal pill, and we use the reversal pill all the time in normal obstetrics to prevent preterm labor and higher multiples, our triplets, our quads, to support early pregnancy, in vitro fertilization. Every one of those pregnancies is supported by progesterone, the exact same progesterone. So progesterone levels go down in a pregnancy, we support that by pregnancy by giving progesterone. When it goes down after somebody's taken the abortion pill, we just support it by giving more progesterone.
And it works is the bottom line.
It works. It is basic science. Healthy moms, healthy babies.
You know, again, some of these claims are the baby's going to be harmed, they're going to have mental issues or physical issues. It's just not true.
Absolutely no evidence for that of all the decades that we've been using micronized progesterone, also known as Prometrium.
This culture of death that's permeating our United States, how can we reverse this and nurture a culture of life? The other side has been so effective at making the baby a blob of tissue to where women, moms, that have the God-given instinct to love that child, to be the mother, the nurturer to that child. Somehow they have been profoundly successful at separating that naturally God-given emotion to where they celebrate. They do a TikTok about their abortion, and they're happy about it. I don't believe that's true underneath, maybe for some women, but just that, even that psychological disconnection seems unnatural.
I agree. One of the most effective tools that we've developed over the past year is actually a curriculum. We know that the truth will set you free, and it is giving them education. So we've developed an 8-week curriculum complete with videos of animations, not the actual surgeries, because some people don't like watching blood, but we have animations of open heart surgery, spina bifida corrective surgery, laser vascular surgery, but we also link that with scripture. And we show how the relationship that God has in the womb and why we have a duty to defend the image of God in the womb. So we have poured our hearts into this. We want to provide it as a tool for the church to use to teach our kids that a pregnancy is more than just one line on a pregnancy test versus 2 lines on a pregnancy test. This is a baby with a heartbeat at 18 days that we can see and we can measure. This is a new life created in the image of God.
Leaning just into the spiritual side of this, taking your doctor hat off, which again I so appreciate and respect the way you are the pastor of your surgery room, if I could say it that way. And I'm sure you come in every day to work with that attitude. You're the minister of medicine.
Absolutely. I
for these
pray over
patients.
every baby that I've delivered.
That's
5,000.
awesome.
What an opportunity to bring new life from the inside to the outside. Of course, you have to pray over that baby.
Yeah, that's great. And then in that spiritual context, it can feel heavy for all of us in the Christian community that are doing this. So 2 parts. What can we do as the lay people, people listening to Focus, watching us on YouTube? If we did more to support women in life, I think this thing would be over. This argument would be done. What are the things that we can do to support your efforts as a pro-life OBGYN, the patients that you see? What are those things that we can do?
You have amazing tools right here at Focus. The ultrasound ministry shows that life in the womb and shows the development of that baby there in the womb. Your local pregnancy center. We have hundreds and thousands of pregnancy centers. We spoke at a banquet here last night. The pregnancy centers need to be supported. They are providing counseling and love and the gospel for these young ladies and men. Men's ministries in pregnancy resource centers are incredibly important. There's only one pregnancy that I know of that did not involve a man, and that was 2,000 years ago. Every pregnancy involves a man. We need to bring those men along. We need to encourage our pastors. This is a spiritual battle. We spoke at a group of pastors at a conference, 120 different pastors in Alabama, and we asked them, how many of you had at least one day of training in how to discuss the issue of life from the pulpit? After 120 pastors, only 3 had had one lecture on how to discuss the issue from the pulpit. Paul, when he wrote to the church of Ephesus, he said, pray for me that I would have the courage to speak as I must. This is Paul. Paul, who get beat up and stoned, got up and went to the next city and did it all over again. We need to go to our pastors and say, listen, I support you. I've been here for years. We need to hear this message coming from the pulpit for the adults for the matter of forgiveness, because between 18 and 24% of the members of our churches have personally been involved with an abortion. They are hurting. They need healing. Healing comes from true forgiveness, and true forgiveness only comes through the gospel.
And I am, the point being that no matter what the circumstances in the culture, we fight for life.
We fight for
Whether
life.
if we're on the mountaintop with great court decisions or in the valley with not so great decisions, and the culture leaning against us, we keep fighting. And I so appreciate what you've done over the years, Bill, and the way you continue to lead the fight as a professional, as a physician, for these little children and their moms. Thank you for that.
You're welcome. It's an honor.
Let me turn to you. Here's the uncomfortable part. Can I make you a little uncomfortable? Let's pour into this. Be part of saving a baby's life. $60 is all it takes. And if we can depend upon you to do just that. I mean, writing a check is often the easiest thing to do, but going and volunteering at your local pregnancy center, getting involved, go to the school board meetings and other things where you can be a champion for life. I would encourage you to do that. Let's take actions in our faith that back up our words. And you can start today by helping us with Option Ultrasound.
Yeah, and along those lines, Jim, of learning more, we do have a new website that we'll link over to. For medical professionals, church leaders, businesses, we want to equip you with a multitude of ways to get involved. There's a continuum of care that you can provide these pregnancy centers and that you can get involved with to make a statement for life. Donate today, get equipped, all at our website. The link is in the program description. Or call us if you'd like. Our number is 800, the letter A, and the word family. 800-232-6459.
And finally, vote life, you guys. If we are Bible-believing Christians, the Lord is for that baby in the womb. I have no doubt. You may be on the fence in that regard. So I would specifically speak to you to look into the Scripture and let the Lord guide your heart on this issue. Don't make it political. This is a moral crisis in the country. So vote life.
And on behalf of the entire team, thanks for joining us today for Focus on the Family with Jim Daly. I'm John Fuller, inviting you back next time as we once again help you and your family thrive in Christ.